Hello, I'm Ouarda BOUABDELLAH, PhD student. Today I will present my intervention about improving the performance of Moroccan university hospitals through the measurement and analysis of technical efficiency using the data improvement analysis method. To conduct this study, we will follow this plan. We will begin with an introduction, literature review, explain the research methodology used, present the results of the study and discussion, and finally we will finish with the conclusion. The efficiency of Moroccan university hospitals is based on the performance of their management, their organization, and their processes. Various reforms in the recent years in the context of the new hospital governance has modified and developed the concept of hospital performance. The aim is to move from a logic of means to a logic of results. So hospitals are committed to optimize the use of their resources, minimize costs, and improve the quality of the public service. So there are different indicators called performance indicators to measure the technical efficiency of Moroccan hospitals. So how can the technical efficiency of Moroccan university hospitals be measured and evaluated? Concerning the literature review, the concept of performance encompasses the notions of efficiency and effectiveness. It's a multidimensional concept which encompasses technology, legislation, teaching and research, management, financial resources, and human resources. Concerning the concept of hospital efficiency, it is the distance between an observed combination of inputs and outputs and the maximum that could have been achieved. Measurement of hospital efficiency consists on comparing the observed cost of a hospital with cost frontier estimated from a set of observation. This distance measure depends on the shape and position of the reference cost function, which depends on the methods used to estimate it. There are two main methods to estimate it, which are econometric methods and no-parametric methods. In our case, we choose the no-parametric methods, which is data envelopment analysis. It is used to evaluate the performance of organization that transform resources into outputs. It's also a method for assessing performance. Data envelopment analysis is a benchmark technique. The organization on the frontier serve as peers or benchmarks for inefficient organizations. These peers are associated with observable best practice. Regarding the research methodology used, we choose non-parametric method, which is data envelopment analysis to measure, evaluate, and analyze the score efficiency for 5 university hospital centers in Morocco. Regarding the results of our study, the efficiency scores were calculated by the data envelopment analysis method using the deep software developed by Kelly and Hall, while opting for a variable scale performance model. This table shows us the global result for efficiency scores for the 5 university hospital centers. In fact, we observed that University Hospital Center number 1 and number 4 received a perfect grade for technical efficiency. University Hospital Center number 2 received an 82.7%. University Hospital Center number 3 received a score of 68.3%, and University Hospital Center number 5 received an 81.5% for technical efficiency score. Concerning the result for University Hospital Center number 1, we observe that technical efficiency is equal to 100% and scale efficiency is equal to 85.7%. We observe that the original value are equal to the projected value, so this University Hospital Center is well managed. It cannot improve its pure efficiency, and it can be identified as a peer for the other University Hospital Center. Concerning the result for University Hospital Center number 2, we observe that technical efficiency is equal to 82.7% and scale efficiency is equal to 92.3%. By improving the way that this hospital is managed, 7.7% of inputs can be saved. We observe that University Hospital Center number 2 can produce the same amount of outputs with fewer inputs. This reduction is equivalent to 17-25% of the original values. To improve its performance, University Hospital Center number 2 must analyze the practices of University Center number 1 and number 4. Concerning the discussion of the results generated by the data envelopment analysis method, we observe that 3 university hospital centers must reduce their inputs. However, in our Moroccan context, the health sector suffers from a shortage of medical and paramedical personnel. Among the reasons why there is a shortage of human resources in the health sector, we can cite immigration of doctors, retirement, and the lack of training. Therefore, through this study, in order to achieve a hospital performance that's concretized by a satisfactory efficiency score, we propose, instead of reducing the number of doctors and nurses, to exploit them, but notably by the increase of the efficiency score will be achieved by increasing the number of staff activities and building the capacity of health professionals to improve the quality of care, the strengthening of the establishment of ambulatory care teams to improve diagnosis for certain diseases like cancer, redeployment of staff to so-called hot wards like emergency services, and enhancing the performance of health professionals while preparing a favorable work climate and condition. As a conclusion, this study explains the foundation of data envelopment analysis and demonstrates this approach measuring efficiency in Morocco University Hospital Center to provide a better understanding of this method. However, in the course of this study, we encountered different obstacles, namely the sample size. So the choice of inputs and outputs was limited because it depends on the sample size and also the unavailability of data, the margin of error. The method used didn't take into consideration other variables which influence the efficiency. Concerning the prospects of our study, we can say expanding the study sample by measuring the efficiency of other hospitals to avoid or to minimize the margin of error, and also adopting another method, which is the two-steps method, which combine a data envelopment method and a regression analysis. And that's all. Thank you for your attention.